All right, welcome back to ABA exam review in the continuation of our BCBA practice question series. We're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our proven combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's keep going. You, a behavior analyst, are implementing a behavior reduction plan for your client who will text while in the middle of a conversation with someone. You provide your client 25 points at the beginning of each week. If the client texts during a conversation, she loses 2 points. Client's behavior decreases in the first week, but then returns to normal levels and slightly increases the next 2 weeks. What might best explain this behavior change based on this information? So we have a rather long question to begin. And as always, we're not going to panic when we get long questions. We're just going to break down what the question is asking and make sure we understand the information given to us. First, the question wants to know what explains the behavior change. So far, we know you have a behavior reduction plan for your client. And the plan includes giving them 25 points and then taking points contingent on conversation. Now, what does that sound like? Part of the exam is going to be you taking information and determining what intervention is being used. In this case, we're using response cost. If I give you 25 points, which is reinforcement, and I take those points contingent on behavior, that's a response cost. Initially, it works, the behavior decreases, but then the behavior goes to normal levels and then increases. So what happened? Why did that behavior decrease at first and then just go back to normal? What's a possible explanation? A, the initial increase or decrease was due to negative reinforcement, which was no longer effective during the second week. Well, A can't be right no matter what because reinforcement never causes behavior to decrease. So A should be eliminated immediately. B, the response cost was too small to sustain the behavior change over time. That's definitely a possibility. Remember, one thing about punishment is resistant to punishment can become a thing if the punishment isn't large enough in magnitude. Your client may have become resistant to it, and after a while, they said, well, I'm not too worried about losing 2 points. I have 25 points. B is very likely. C, the client satiated on the reinforcers that were available to them. Well, that wouldn't explain why the behavior decreased at first and then returned to normal levels. We're not even discussing what reinforcement was available to them. And if anything, their behavior increased the next 2 weeks. So C doesn't really fit the information given. And then D, the plan was not implemented with fidelity. Again, the information given, we're only working with the information given, doesn't make any indication that the plan was implemented incorrectly. Based on this information and our answer choices, it's most likely 2 points was initially punishing, because it's a response cost, and then it lost its effectiveness over time. The response cost was too small to sustain the behavior change over time. Naomi is considering options for her daughter who will ask for juice constantly whenever she gets home from school. Naomi decides she will provide her daughter with water on the way home from school in an effort to avoid the juice asking behavior. What type of antecedent intervention is Naomi likely using? Couple keys here. One, we have an antecedent intervention. So make sure you're picking something that is happening prior to the response. It's an antecedent. And two, we have to decide, well, what is Naomi trying to accomplish? Well, we know the daughter asks for juice constantly. She gets home. And so now, what does Naomi do? She gives her daughter water to avoid the juice asking behavior. So based on this information, what is Naomi trying to accomplish? Well, if she's going to give the daughter water, she's trying to do what? She's trying to abolish the need for juice. And that's the effort to avoid the juice asking behavior. If I give you water, the value of juice will likely go down. So what type of antecedent intervention could that be? A, abolishing operations. Sure, Naomi is trying to abolish juice as a valuable consequence. And she's doing it by providing water on the way home before juice asking can occur. An establishing operation is going to increase the value of a consequence or an item or whatever it might be. In this case, Naomi doesn't want to establish juice as valuable. She wants to abolish juice as valuable. C, response prompting. We don't discuss prompting here. We're not talking about stimulus or response prompts. C, doesn't fit. And then D, functional communication training. Yes, her daughter is asking for things and not asking for things, but Naomi isn't explicitly teaching her different ways to communicate needs and wants. She's simply trying to abolish the value of the juice, which is going to reduce the juice asking behavior. The type of antecedent intervention Naomi is using is A, an abolishing operation. Anytime Mr. Jones says that it's time to start independent reading, Susan will ask to use the bathroom. Mr. Jones adjusts his strategy, is now letting Susan take a bathroom break after she reads for 5 minutes independently during independent reading time. What is Mr. Jones likely attempting if he wants to increase reading time? All right, so we have a intervention question that's likely dealing with consequences. And we know Mr. Jones wants to increase reading time. So what is he attempting if he wants to increase? Well, immediately we know if he wants to increase behavior, what is he attempting? It's got to be reinforcement. It can't be punishment. It can't be extinction, because if he wants to increase behavior, it's got to use reinforcement. So we know that whenever Mr. Jones says it's time to read, Susan wants to go to the bathroom. Looks like escape. Mr. Jones adjusts and says, okay, Susan, you can take a bathroom break after you read for 5 minutes during reading time. So now he's using escape from reading as the reinforcement for reading. But what is Mr. Jones attempting? Is it A, positive reinforcement? Well, he's allowing Susan to escape the reading. Previously, Susan would escape the independent reading by going to the bathroom, but now she has to read for 5 minutes before she can escape the independent reading time. So what Mr. Jones is likely using is some sort of negative reinforcement. It's the removal, right, of the task demand. Now, you could say, well, why is it not adding bathroom break? Well, Susan's already getting the bathroom break, and Susan's attempting to accomplish getting out of reading time. So the strategy now is you can leave and get out of reading time if you read for 5 minutes during independent reading time. Mr. Jones is likely attempting negative reinforcement to increase that reading time. Tiffany is reinforced at her ABA clinic every 3 times she functionally communicates her need to use the bathroom to her technician. When she is at home, Tiffany receives reinforcement every 6 times she functionally communicates her need to use the bathroom to her parents. Tiffany has adjusted to and understands both reinforcements in each setting. What type of schedule is this? We have a reinforcement schedule question. And with the reinforcement schedules, we have simple schedules and compound schedules. Compound schedules are nothing more than 2 or more basic schedules combined, right? Hence, compound schedule. So how many schedules do we have working here? Well, we've got 2 schedules. At the clinic, every 3 times she communicates, she gets reinforced. So that looks like an FR3. When she's at home, every 6 times she communicates, she gets reinforced. So we have an FR3 working, FR3, and 6, right? So we have 2 different schedules working. Now, it's in 2 different environments, right? And it's seemingly going to be either rotating randomly or rotating sequentially, depending on where Tiffany's at. So if we have 2 or more schedules that are rotating or introduced randomly, what would we consider those schedules? Would it be a mixed schedule? Well, it is a mixed schedule, but it's also a multiple schedule. It's not a concurrent schedule, because concurrent schedules are 2 schedules operating simultaneously, offering choice. Tiffany doesn't really have choice here because she's either at the clinic or at home. And it's not an alternative schedule. An alternative schedule features a ratio and interval schedule. You must complete one or the other. So looking at mixed or multiple. And so the differentiator here is going to be the SD. Now, given that Tiffany has adjusted to and understands the reinforcement schedules in each setting, that is indicating there's an SD for these schedules. Because when she's at the clinic, there's plenty to signal 3 times. When she's at the home, there's plenty to signal 6 times. There are SDs signaling what schedule is available. The type of schedule we're dealing with here is a multiple schedule. So when you're dealing with compound schedules, right, when you're dealing with things like chained and tandem schedules, alternative, conjunctive, mixed, multiple, the key difference between those pairs is an SD signaling the presence or is it not? In this case, since the SD is signaling the presence, it is a multiple schedule. College professor wants to find out if his students prefer to have class in person on Zoom or a mixture of both. He puts the 3 options on a piece of paper and tells his class to rank each from 1 to 3. What type of assessment is this? Very straightforward preference assessment question. We know we're looking for the type of assessment. The professor wants to know what the students prefer. Preference assessment. He's got a piece of paper with 3 options on it, and the students have to rank it. What type of assessment would that be? Would it be A, a forced choice? With a forced choice, the professor would present 2 options at a time and make the students pick. He's not doing that. It's all 3 on a piece of paper, and he's not even doing it directly. So this is more of an indirect assessment than anything. What about C, a single choice? With a single choice, you're presenting 1 at a time. Again, not doing that. And then D, multiple stimulus with or without replacement. Well, we aren't removing anything once they're chosen because these are being ranked indirectly by the students. So what type of assessment is the professor using? He's using B, an indirect assessment. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Subscribe if you haven't already. Let us know when you pass so we can include you in the Sunday shout out. Work hard, study hard. See you soon.